dysfunction. People want to know what causes essential hypertension, and if you're a doctor and you study hypertension in medical school, you're taught that this is one of the most important changes as an indicator of someone's health getting worse. Consequently, if someone's blood pressure goes up, the first thing we're taught to do as doctors is reduce their circulating blood volume. We'll put them on a water pill, that'll fix it. And what happens to the cardiovascular regulation mechanisms after that happens is, well, see, the reason that happens is your heart is having trouble getting blood to your feet and back. And why would it have trouble? Because as these immune complexes I've talked about in other videos, as this immune complex stuff is evoked in the terminal ileum and the colon, what that does to the vascular system is it clogs up the liver. Now, how many patients do you see whose lower thoracic spine is all flared out and taut? If you're a massage therapist, you'll think it's dearly everybody, and I'll tell you, it's 5 out of 6 people, if you take just random people, will have tightness and congestion at the T8 and 9 levels. And those are the segments of the spine that innervate the small bowel, the pancreas, and the liver. Now, the liver is processing all these antibodies that are coming in from the bowel, and when it becomes congested, then a pressure can build up under the diaphragm. How that pressure affects the patient's physiology varies on how much pressure builds up and how they hold their insides. Because if it builds up a lot under the diaphragm and they don't have a lot of pressure building up under the stomach, they will start to elevate their blood pressure to get the blood past this pressure to the feet and back. And that's why reducing the circulating blood volume at first seems to work, because with less blood to work with, the heart can't keep pumping harder to get the blood to the feet and back. So that's why most people can be controlled with mild essential hypertension by giving them a water pill. But the trouble is you're thwarting the body's physiology, and the heart is trying to get blood to your feet and back and you're telling it not to. But after a while, the body will adapt to this and say, okay, that didn't work, what else can we do? And so it raises the tone in the blood vessels in order to try to get the blood past this pressure in the liver to the feet and back, and past the pressure as it comes back, by raising the blood pressure some more. So we put them on step 2 blood pressure medicine. And those are things that thwart this contraction of the arterioles to raise the blood pressure and get it past the liver in the face of this caking up of immune dysfunction in the liver. So the cause of essential hypertension, for those who don't know it, is congestion in the liver that is coming from the gut.